Abdominal aortic aneurysm, often abbreviated as AAA, is a potentially life-threatening condition that affects the largest blood vessel in the human body. This serious medical issue occurs when a section of the abdominal aorta, which is the main artery that supplies blood to the lower half of the body, becomes weakened and bulges outward like a balloon. As the aneurysm grows, the risk of rupture increases, which can lead to severe internal bleeding and, if left untreated, death. The aorta is a large muscular artery that originates from the left ventricle of the heart and extends down through the chest and abdomen. It's responsible for distributing oxygen-rich blood to all parts of the body. The abdominal section of the aorta, which runs from the diaphragm to the pelvis, is particularly vulnerable to aneurysm formation. In a healthy aorta, the vessel wall is strong and elastic, able to withstand the constant pressure of blood flowing through it. However, various factors can weaken this wall over time, causing it to lose its elasticity and structural integrity. As the weakened area expands, it forms a bulge or balloon-like protrusion. This is the aneurysm. The larger the aneurysm grows, the higher the risk of rupture, which can result in massive internal bleeding and a medical emergency. Abdominal aortic aneurysms are more common than many people realize. In fact, they affect a significant portion of the population, particularly as people age. In general, it's estimated that about 4 to 8% of men over 65 years old have an abdominal aortic aneurysm. The condition is less common in women, affecting approximately 0.5 to 1.5% of women in the same age group. Causes of abdominal aortic aneurysm. The causes of abdominal aortic aneurysms are multifaceted and often involve a combination of genetic and environmental factors. One of the primary contributors is atherosclerosis, which is a condition where fatty deposits build up in the arteries, causing them to harden and lose elasticity. This process weakens the aortic wall, making it more susceptible to aneurysm formation. Smoking is another major risk factor for AAA. The harmful chemicals in tobacco smoke can damage the aortic wall and accelerate the progression of atherosclerosis. In fact, smokers are up to 8 times more likely to develop an abdominal aortic aneurysm compared to non-smokers. High blood pressure or hypertension also plays a significant role in the development of AAA. The constant force of elevated blood pressure against the aortic wall can gradually weaken it over time, increasing the likelihood of aneurysm formation. Additionally, chronic obstructive pulmonary disease, or COPD, has been associated with a higher risk of AAA, possibly due to the increased pressure in the chest cavity and the effects of long-term inflammation. Genetic factors also contribute to the development of abdominal aortic aneurysms. Some people inherit connective tissue disorders, such as Marfan syndrome or Ehlers-Danlos syndrome, which can affect the strength and elasticity of blood vessel walls. Family history is another important consideration. Individuals with a first-degree relative who has had a AAA are at a higher risk of developing one themselves. Age and gender also play roles in AAA development. The risk increases significantly after the age of 50, and men are 4 to 6 times more likely to develop an abdominal aortic aneurysm than women. However, when women do develop AAA, they tend to do so at an older age and may have a higher risk of rupture. Symptoms of abdominal aortic aneurysm. One of the most challenging aspects of abdominal aortic aneurysms is that they often develop and grow without causing any noticeable symptoms. This silent nature makes them particularly dangerous, as they can reach a critical size without the person being aware of their condition. However, as an aneurysm grows larger, some people may experience symptoms. When symptoms do occur, they can vary widely depending on the size and location of the aneurysm. Some individuals may feel a pulsating sensation in their abdomen, similar to a heartbeat. This pulsation is most noticeable when lying down and can be felt around the navel area. Others might experience persistent abdominal or back pain, which can range from a dull ache to a severe throbbing sensation. This pain may be constant or come and go, and it might worsen after eating or when changing positions. In some cases, people with AAA report feeling full quickly when eating, even after consuming small amounts of food. This sensation occurs because the enlarged aorta can press on the stomach and intestines, reducing their capacity. Nausea and vomiting can also be present in some individuals with large aneurysms. It's important to note that these symptoms are not specific to abdominal aortic aneurysms and can be caused by many other conditions. This nonspecific nature of symptoms contributes to the difficulty in diagnosing AAA based on clinical presentation alone. The most alarming symptoms occur when an aneurysm ruptures or is about to rupture. This is a life-threatening emergency that requires immediate medical attention. Symptoms of a rupturing AAA include sudden, severe pain in the abdomen or back, dizziness, rapid heart rate, sweating, and shortness of breath. Some people may lose consciousness due to the rapid blood loss. If any of these symptoms occur, it's crucial to seek emergency medical care immediately. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of abdominal aortic aneurysm. The process of diagnosing a AAA typically involves a combination of physical examination and imaging studies. During a physical exam, a doctor may be able to feel a pulsating mass in the abdomen of some patients with large aneurysms. However, this method is not reliable for detecting smaller aneurysms or those in individuals with obesity. Therefore, imaging tests play a crucial role in accurately diagnosing and assessing AAA. Ultrasound is often the first-line imaging test used to screen for and diagnose abdominal aortic aneurysms. This non-invasive procedure uses sound waves to create images of the aorta, allowing doctors to measure its diameter and identify any bulging areas. Ultrasound is painless, does not involve radiation, and is relatively inexpensive, making it an excellent tool for both initial screening and follow-up examinations. CT scans and MRI scans can also be used to provide more detailed images, especially if the aneurysm is complex or if surgery is being considered. These imaging techniques help determine the size of the aneurysm and assess the risk of rupture. Treatment for abdominal aortic aneurysm. The treatment approach depends on several factors, including the size of the aneurysm, its rate of growth, and the patient's overall health. The primary goal of treatment is to prevent rupture, which carries a high mortality rate. For small aneurysms, less than 5.5 centimeters in diameter, a watchful waiting approach is often recommended. This involves regular monitoring with ultrasound or CT scans to track the aneurysm's growth. During this time, patients are advised to make lifestyle changes to reduce risk factors. These changes include quitting smoking, controlling blood pressure and cholesterol levels, maintaining a healthy weight, and engaging in regular, moderate exercise. Medications may be prescribed to help manage conditions that contribute to aneurysm growth. For example, beta blockers can help lower blood pressure and reduce stress on the aortic wall. Statins, which are typically used to lower cholesterol, may also help slow the growth of small aneurysms. When an aneurysm reaches a size of 5.5 centimeters or larger, or if it's growing rapidly, surgical intervention is usually recommended. There are two main surgical approaches to treating abdominal aortic aneurysms: open surgical repair and endovascular aneurysm repair, or EVAR. Open surgical repair is the traditional method of treating AAA. In this procedure, a surgeon makes a large incision in the abdomen to access the aorta directly. The damaged section of the aorta is removed and replaced with a synthetic graft. This graft is sewn into place and acts as a new lining for the weakened section of the artery. While open surgery is highly effective, it's a major operation that requires a longer recovery time and carries more risks, especially for older patients or those with other health issues. Endovascular aneurysm repair is a less invasive alternative that has become increasingly popular in recent years. In this procedure, the surgeon makes small incisions in the groin area and uses special instruments to guide a stent graft through the blood vessels to the site of the aneurysm. The stent graft is then expanded inside the aorta, creating a new path for blood flow and reducing pressure on the weakened aortic wall. EVAR typically results in shorter hospital stays and quicker recovery times compared to open surgery. However, it requires long-term follow-up with imaging studies to ensure the stent graft remains in place and functions properly. The choice between open surgery and EVAR depends on various factors, including the patient's age, overall health, the anatomy of the aneurysm, and the surgeon's expertise. In some cases, a hybrid approach combining elements of both techniques may be used. Now, we want to hear from you. Do you or someone you know have abdominal aortic aneurysm? What treatments did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.